Do you ever wonder why your knees crack or pop when you stand up, squat, or take the stairs? Is it a bad sign or just a normal part of aging? Today, I'll break it down and help you understand what's going on inside your joints. Hello, I'm Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, regenerative medicine, and rheumatology. My goal is to help you stay pain-free and healthy without surgery. Let's get into it. Cracking, popping, or clicking in your knees, also called crepitus, is super common. But should you be worried? Is it a sign of arthritis? Will it lead to long-term damage? Or is it just a harmless noise? The truth is, it depends. Let's break down what's happening inside your knees and when you should pay attention. Let's start with the basics. Your knee joint is made up of bones, cartilage, ligaments, and fluid. When you move, different parts of the joint interact, sometimes making noise. Here are the most common reasons why your knees might crack or pop. Gas bubbles. This is benign popping. Ever cracked your knuckles in your hands? That's from gas bubbles in your joints. The same thing happens in your knees. As the joints move, the gas bubbles form and then collapse, making a popping sound. Totally normal and not a cause for concern. Then you've got tendon or ligament movement. Your knee is surrounded by tendons and ligaments that help it move. Sometimes they may shift slightly over bones, especially if they're tight. That snapping sensation, it's usually just soft tissue moving and not damage. If you have pain, that could be another issue, however. Then there's cartilage changes or rough surfaces. Over time, the smooth cartilage that covers your knee bones can wear down. If the surface is not perfectly smooth anymore, it can make crackling or grinding noises called crepitus. This can be normal with age, but if it's painful, we need to talk. And then there's meniscus tears or loose cartilage. This is problematic popping. If your knee suddenly starts locking, catching, or popping painfully, a torn meniscus or loose cartilage could be the cause. These types of injuries may require treatment to prevent further damage. Then there's arthritis and inflammation. Osteoarthritis and inflammatory arthritis conditions like rheumatoid arthritis can cause rough joint surfaces and extra fluid, leading to more noticeable popping and pain. But catching it early can make a big difference. Not all knee noises are harmless. Here are signs that something may need medical attention. If you have pain with popping, if your knee hurts every time it pops, something deeper may be going on. If you have swelling or stiffness symptoms, inflammation can indicate arthritis or an injury. If you have locking or giving out symptoms, if your knee catches, locks, or feels unstable, it could mean a meniscus tear or ligament tear is present. And then if you have new or sudden cracking after an injury, if you hear a loud pop followed by pain, especially after a fall or twist, it could be a ligament tear like an ACL tear. If you're experiencing any of these, it's time to see a specialist to prevent long-term damage. The good news, you can improve your knee health and even reduce cracking in some cases. Here's how. Strengthen your leg muscles. Stronger quads and hamstrings support the knee and reduce unnecessary movement. Stay flexible. Stretching and mobility work help prevent tight tendons from snapping over bones. Focus on anti-inflammatory nutrition. Foods like leafy greens, fatty fish, and turmeric can help protect your joints as well. And move regularly. But avoid overuse. Low-impact activities like cycling, swimming, and walking keep knees strong without excessive wear and tear. And then, of course, you should be maintaining healthy body weight. Less weight on your knees means less stress on the joint, reducing wear and tear over time. Understand that making small changes now can protect your knee health for years to come. Some common myths about knee cracking. Number one, if my knee cracks, I must have arthritis. That's not necessarily true. Cracking can happen in perfectly healthy joints. Arthritis is usually diagnosed based on pain, swelling, and stiffness, not just noise. Cracking my knees will lead to joint damage. That's another frequently asked question and common misperception. There's no evidence that harmless cracking causes damage. However, if it's painful or unstable, that's a different story. Number three, only older people have knee cracking. Not true. Young athletes and even kids can experience knee popping due to ligament movements or minor imbalances. Next common misconception, the only solution is surgery. Absolutely not. Many knee issues can be managed with exercise, physical therapy, and regenerative medicine options without surgery. So what did we learn today? Most knee cracking is harmless and caused by gas bubbles or normal joint movement. However, if you have pain, swelling, or instability, get checked out. It could be an injury or arthritis. Strengthening the muscles, stretching, and a healthy lifestyle can improve knee health and reduce unwanted cracking. And surgery is not the only option. Many knee conditions can be treated non-surgically. If this video helped you, make sure to like and subscribe. And if you have knee pain or concerns, check out our website at chicagoarthritis.com or book a consultation. I'd love to help you stay active and pain-free. Until next time, stay healthy and live well.